Why are silent heart attacks happening?
Silent heart attack means a heart attack without any major symptom. Symptoms, as we all know, are severe chest pain, which is radiating to the arm, or with suffocation, with sweating, with घबराहट, which is something non-specific, but it is very commonly told by the patient, घबराहट हो रही है. So if there is severe chest pain and along with the radiation, the ECG confirms a heart attack, this is actually a normal heart attack. Silent heart attack means the patient has no warning, neither warning, nor there is chest pain, a so subtle घबराहट which may not be mimicked with any cardiac problem, or a subtle a small episode of a palpitation, or a small episode of a sweating, and the patient has, he goes for the ECG, and ECG finds to be a severe heart attack showing ST elevation in the anterior lead or inferior lead depending upon the artery which is blocked. At the same time, many times the patient can have a sudden cardiac arrest.
I want to know what's your prognosis, in the sense that is it because of lifestyle? Is it because of, are we exposed to certain things which have dramatically changed the way our body is not shaped up to, like noise, less sleep, continuous working, constant constant source of those liquid or edibles which keep you awake, excited all the time, which your body 100 years ago wasn't working like that. Is it because of that?
In the older population earlier, there's a cholesterol deposition which starts at the age of, even people say it can start even the fetal side, but slowly the cholesterol deposits in these arteries. And when these arteries get cholesterol deposit, at that time, when it goes beyond 70%, the patient will have angina. When it goes more than 90%, patient will have rest angina. And it is 100% acutely, it can lead to heart attack. It was happening mostly after the age of 60, 65, 70. Earlier, I'm talking of 20 years back. During this time, especially after COVID, we are finding young people getting affected very often. And even when the treadmill test or echocardiographic test or ECG test done only few hours back or few days back is normal. Why it is happening? These cholesterol plaque, which is just 20, 10 to 15, 20, 30%, they can rupture. Rupture means there is the area on the plaque. If you see the tube is an artery which is supplying the blood. Inside there is a cholesterol deposition.
I know,
And those cholesterol deposition, if they are soft, then they can have a platelet and a clot formation, which leads to complete occlusion of the artery within a matter of few minutes or few hours. And that is heart attack. So